Hi, Tom. Thanks for coming to the Ehrhardt Center. I know you had great success here, and I just wanted to hear a little bit more about your story so we can share it with others.
Sure, that sounds great. So in 2010, I was diagnosed with atrial fibrillation. In 2014, I suffered greatly from congestive heart failure, ended up in the hospital for 4 or 5 days, put me on a bunch of medications, and I started to feel somewhat better, but not great. And I kind of weaned myself off these medications because I don't really believe in medications. And uh, I was doing okay for a couple of years, and then in 2015, I had another very bad bout with congestive heart failure, which included suffering from an enlarged heart and cardiomyopathy, which was the result of having this enlarged heart. I wasn't functioning well,
Okay.
and I still was on a couple of these medications, and but they didn't really seem to do the trick. So I was looking for an alternative medicine doctor because I felt that that was a way to possibly get cured.
Okay.
My cardiologist was saying that she didn't know if she could really cure me, but she could just keep me steady. So
Okay.
anyway, I came to Dr. Ehrhardt and the center here,
Uh-huh.
and doctor recommended certain diet, changed my diet around quite a bit, uh, numerous supplements, and I had a serious bout. I even had a TIA actually, a small stroke in end of 2015. Came here around that time,
Okay.
so I've been coming here about a year and a half,
Okay.
and my latest diagnosis, as a result of the treatments that I've had here, is that my ejection fraction, which was down to, I don't think I mentioned, was down to 10 or 15 when I started. It's now up to 55,
Wow.
which is very close to normal.
Great.
And my enlarged heart is no longer enlarged. It was 50% enlarged when I came here.
Mm-hmm.
The last echocardiogram just a month or so ago said my heart was no longer enlarged.
Wonderful.
And I can tell all of this because I feel so much better. I'm almost totally off medications, just one tiny medication, and I'm taking just a few milligrams of.
Okay.
And I'm just sticking to the diet that Dr. Ehrhardt has given me, and to the supplements.
So he's given you a diet, but can you explain a little bit more? You brought in your urine and saliva every week,
Yes.
correct? And then he did testing just for you specifically.
Exactly,
So-
and he could tell from my urine and saliva what I was eating and what if I had too much salt or too much sugar, and I needed to cut down. So I came here every week for a year at least,
Okay.
and doctor kept guiding me on my diet and he knew when I went off the diet once in a while, and so I'd get back on it, and so I would just make sure I did what Doc told me to do, and the cardiologist actually, when I took the last echocardiogram, I don't think she could believe it. She was like staring at the machine and saying, "Wow, just keep doing what you're doing."
Wow.
And
That's
my
incredible.
cardiologist, when I first mentioned about the supplements I was taking, she really wasn't interested in supplements. I don't think she could think they could work.
Okay.
But they obviously have worked, and I'm feeling much better. I'm doing the other thing that Doc put me on was exercise. So doing a lot of walking.
Okay.
I'm doing some yoga
Great.
2 or 3 times a week, and swimming. And so that was the third leg. In addition to the supplements and the diet was the exercise. And
Okay.
so it's just been great when I've and the testing that. And one other testing was the HRV testing, which was constantly monitoring my heart and the function of my heart,
Okay.
which helped, to again guide me when I was getting off track a little bit.
Right.
So
Wonderful.
it's been great to be here. I'm so thrilled to be back in good health,
Wonderful.
and I have recommended at least half a dozen patients to come here, and they've all been very happy.